This is a story of blindness and recovery, of teamwork, and perhaps a miracle.
Cornea is intact, the sutures look good.
Juan Ramos had a successful cornea transplant more than a decade ago, but a recent household accident crushed his left eyeball and threatened to rob him of sight. The globe was ruptured, and the contents of his eye were spilling out. Juan's family rushed him to Baptist Emergency Hospital in Westover Hills, where an ER physician immediately contacted ophthalmologic surgeon Dr. William Sponsel for a consult.
Believe me, it's a shocking sight.
He said, I need to tell you right now that you might not be able to see.
The emergency hospital workers hooked up IVs and got Juan ready for surgery. By now, it was night. Time was critical. Juan was transported by ambulance to downtown Baptist Medical Center, where a specialist eye team busily prepped an operating room. They were waiting to try and save Juan's eye.
They were already dressed up. I mean, they were ready. And I was just amazed that it happened so quick.
We just worked in the hope that maybe this guy had something worth saving.
Dr. Sponsel operates often at Baptist Medical Center. That night, though, there were a lot of unknowns.
I had a total A-team in that OR that night.
The team needed to reinflate a totally collapsed eyeball. The surgeon carefully injected tiny amounts of what's called viscoelastic, a substance used to restore the shape of the eye, and he placed sutures in the cornea to hold it in position. By the time the surgery was over, it was 3 o'clock in the morning. The next day, Juan returned to Sponsel's office for a checkup.
It was perfect. We took the patch and shield off, and you could see for 360 degrees. There was not a single peripheral defect. Amazing.
Adding to hope, Juan could see every color in the rainbow and read a chart across the room.
And this is truly miraculous. I mean, this is kind of an amazing event.
The scan on the left is Juan's eye just after the trauma, flat, drained. The scan on the right, after his emergency procedure. You can see the eyeball is filled, round, and actually able to see. Several weeks after his procedure, Juan follows up with Dr. Sponsel, who is still overwhelmed by the outcome.
Nice. This could not have happened if people hadn't really all worked as a wonderful team. I like what they've done at Baptist. They've done a really nice job coordinating every level of this system.
Juan is grateful for the use of an eye he thought was lost. He believes the compassionate, timely care he got at Baptist made all the difference.
They have a sweet spirit of caring for the patient, and I saw that from beginning to end.
This looks like hopeless, and it ends up with an astonishingly satisfactory outcome. It's an amazing event. Congratulations.
Excellent emergency care that stretches from your neighborhood to the experts in the operating room. That's the difference. That's Baptist Care. For more information, log on to baptisthealthsystem.com or call 210-297-7005. For the Baptist Health News Network, I'm Wendy Rigby.